46-year-old Fiona Moore found out that she is HIV positive at the age of 30. Now, 16 years later, she is healthy and a community activist and advocate for HIV testing and treatment. Moore says the work to break the stigma around HIV must continue in order to prevent illness and save lives.
There is many women out there that don't know what magic the ARVs can do, right? Some women are scared to go for the ARVs. Some women think that the ARVs is going to let them die, something it's going to make them sick. But if you find out about your status, go on medication. Take your medication regularly. Nothing will happen to you. You can live longer than the person, I would make an example, that's living with cancer, that's living with diabetes, because the ARVs is your way forward.
The Undetectable Equals Untransmittable campaign has coincided with the launch of a mobile wellness hub in Westridge. Here, every Tuesday, residents will be able to access a wide range of healthcare services, HIV testing among them.
We've got about 580,000, something like about 500,000 of the people who are living with HIV. Out of those, you'll find that almost 59% of them are actually on ARVs, which is actually, it's quite concerning. Of course, there might be the issues with the data in terms of the interpretation and also the system, but when the international political campaign of 95, 95, 95, which is at least 95% of people living with HIV must know their HIV status. Of those, 95% must be on the ARVs. Of those, at least 95% is supposed to have a viral load that has been suppressed. So with the first 90 of people knowing their HIV status, we're doing very well. And then with the last 95 of the people who are supposed to be on ARVs, who are supposed to have a viral load, is still a challenge.
Anti-retroviral treatment lowers the viral load in the blood. When a person's viral load is sufficiently suppressed, they will not sexually transmit HIV to their partners.
If you look at the statistics, what's really scary is that the number of younger women who are HIV and AIDS positive is almost double that of men, and it is amongst young women the leading cause of death. And for me, it is something that through medicine we can stop. So if you must get tested, you must know your status. If you are HIV and AIDS positive, you can actually be undetectable, which means you've got to be on your antiretrovirals. And that's as simple as that. It's not a difficult thing to do.
The campaign must and will be community-driven, with civil society and NGOs partnering with healthcare authorities. U equals U is a global effort to decrease the stigma around HIV and improve health outcomes.
To see the change from a time when a positive test result was almost a death sentence to meeting people here today who've lived with HIV/AIDS for 20 years. They have a partner who's negative, they live a normal lives, they're married. That's why the U equals U is so important. It demonstrates that not only is it not a death sentence anymore, but you can live a normal, healthy life, have a family, have a partner. So it's really important to do this.
Authorities say the campaign's key message is how the sexual transmission of HIV can be stopped through effective treatment of those who test positive. Vanessa Puna, SABC News, Mitchells Plain.